Welcome back. Let's continue the program of today and jump directly into our next session, which will be a panel hosted by our VP Americas, Tom Ruth, on how accurate location is and will transform the healthcare sector. Handing over to you, Tom.
Hi, I'm Tom Ruth, Vice President of the Americas for Quuppa, and today I'm going to be leading our roundtable discussion for healthcare and its use of RTLS. I've got three esteemed panelists with me today, and I'm going to introduce Dr. Susan Gutman, who is Vice President of Operations at Nessa Solutions, a longstanding Quuppa prolific partner. Susan has her doctorate in nursing and a master's in health administration from the University of Miami. She has over 24 years of professional leadership experience in Southern Florida in a variety of different hospitals. She's at NASA operationalizing and deploying the NASA digital innovation in healthcare solutions, as well as in other industrial solutions as well. Stephanie Anderson, who is a 20-year software veteran stemming from Microsoft. In her last 10 years, were focused on the healthcare industry, specifically as it pertains to RTLS. She's the co-founder of Zillifly, which is a market-leading software platform that has a variety of different solutions focused on the healthcare industry. Her experience in working across a variety of different RTLS platforms gives us a unique view to the market and how different solutions are implemented. And last would be Vikas Gayal, who is the Vice President of Business Development for Artisight. Artisight is a new Quuppa partner. Vikas has a depth of clinical operations experience in academic hospitals, specifically and foundationally with the Washington University Hospital, as well as with the University of Chicago Medical System, where he had led a design, construction, and activation of a $40 million ER project in the construction of an emergency room. And he was also the admin lead to develop the University of Chicago's Level 1 Trauma Center, which is and has been nationally recognized for his work there. I'd like to welcome all the panelists and would like to bring them in now and get started. Today's conversation, we're going to cover a wide variety of topics. I'd like each one of you to kind of give me a quick bio on your company and your value prop in the space. Susan, I'll start with you.
Sure, thank you, and thank you for having us. So at Nessa Solutions, we're a location-based workflow management platform capable of ingesting and integrating with any location, IoT, or computer vision and other data under one single architecture, and we leverage that in real time. So what this does is it allows our customers or companies not only to build unique and scalable workflows automating their manual processes, but it also allows the power of real-time data to be placed in the hands of the companies to really drive critical decision-making that help them become more productive, increase revenue, and safety for all. So thank you for having us.
Thank you, Susan. Vikas, tell us a little bit about Artisight.
Yeah, thanks, Tom, for having Artisight part of this. So Artisight is a healthcare IoT platform company that really focuses on leveraging passive sensors to improve efficiencies in the healthcare clinical space. Our platform approach is really designed to help solve problems in the healthcare environment by providing real and accurate data to our frontline staff as well as frontline administrators. And with this data, they're able to really optimize their workflows, make the appropriate adjustments to ensure that their patients have the best experience when in their environment.
And Stephanie, Zillifly comes to us from the software side of the equation. Tell us a little bit about Zillifly.
Yeah, thanks for having us, Tom. So Zillifly is a software platform application and database. We typically focus in healthcare and across the entire healthcare continuum, from acute senior care facilities and also then specialty clinics or ambulatory settings. Our application does apply to multiple other industries as well, along the same lines as asset management, staff dress, workflow, etc. We've started to see a really nice uptick internationally as well in those industries with contact tracing has been a huge advantage for us too.
Great. So I have a number of questions here, and obviously, and we talk a lot about RTLS at Quuppa, and how it gets applied. And I realize applied to the healthcare space, this is really just one data set that I know that each one of your solutions considers in rendering its solutions. Tell us a little bit about, RTLS can cover a wide variety of opportunities. What specific of the businesses benefit the most from RTLS? Stephanie, I'll start with you.
Sure. So asset tracking is probably the most well-known within RTLS and especially healthcare. I think that's what a lot of facilities always started out with, especially when RTLS became popular 10 to 15 years ago. But really what we're seeing are the movement into patient workflow, staff duress, a lot around temperature and environmental monitoring, and then also staff rounding is absolutely part of that. Some of the big benefits that I think we're going to start seeing is the ability to take in location data from people and things that are not wearing tags. So a lot around occupancy data, but also things where we're going to use location data to start turning on lights, opening elevators or doors, changing visual signs based on location data instead of what we think of as traditional RTLS. So a lot of exciting things are going on.
Interesting. What about you, Vikas?
Yeah, I think that was a great answer, Stephanie. I think a lot of the things that I would say, echo that the first step into the healthcare side when it comes to RTLS, the easiest aspect of it is really asset tracking. It's the least risky kind of proposition for an administrator to undertake. But I think the area that's really ripe for RTLS is the clinical operations. So similar to what Stephanie said, but also just the focus on really leveraging the RTLS to improve that staff and patient experience. Being able to really start to mitigate and take away work that the staff have to do currently that could be provided to them by having these passive sensors capture data to help determine their workflows and move patients through their system, I think is really the next evolution of how we're going to be able to leverage RTLS. I think there's been minimal penetration in the clinical operations because of the complexity of these clinical operations and the workflows that are designed there. And so really ensuring that you have folks that understand that workflow and being able to work with frontline staff to design the appropriate workflows to have the technology help augment that and not create additional pain points for them.
So that's interesting. When you mentioned workflows and tracking, you were talking about tracking personnel through the healthcare process, if you will. One of that kind of leads us to the tracking of personnel, and whether they be healthcare workers or whether they be patients. Susan, you have a lot of experience with this. What challenges do healthcare providers have when implementing personnel tracking?
Yes, thank you. So, and I too, by the way, echo Stephanie and Vikas. They have great responses for what is up and coming with RTLS. The one thing I would add as well, the impact that computer vision and cameras will be making in the healthcare space will be tremendous as well. When it comes to personnel, being a clinician, being in the front line, being a bedside nurse, and now being on this other end working with the software location base that we have, it really brings that additional level of sensitivity to the healthcare space specifically. Bedside nurses were very aware of HIPAA laws and whatnot, but we take it to an additional level now because we feel as nurses that we may be being monitored. So you have that big brother aspect, but as administrators, we need to understand that and share the information with those frontline workers and let them know that it's for their safety. Not just that, it will streamline their workflows and actually make their work easier, not harder. So it's not Big Brother, but it provides additional level of safety, productivity, efficiency, and really allows them to focus on the patient.
That's an interesting topic. I remember having a conversation with each of you, at least at one point, surrounding this challenge of the way technology decisions get presented to the actual staff themselves. So how do you implement that, Stephanie? I mean, have you seen issues with, whether it's top down from management or whether it works better bottoms up?
Susan knows this better than all of us because she had done this for so many years, and she's spot on. I couldn't echo it any better. Big Brother was one of the things too that were in my thoughts and my comments thinking about that question in particular. The best way that I think we would all agree to see this implemented is open communication and talking about the value add of why are we doing it. And it isn't to keep track of you, it's truly to protect you. That when you press the button for staff assist, we know where you are and it goes out immediately. Open communication, talk about it, talk about the value add of the reporting and how it alleviates a lot of those he said, she said type scenarios as well around providing care.
And I think we're having some technical difficulty there, Stephanie, on the last piece of your delivery there. Could you repeat that last sentence?
Sure. In general, open communication around the whole goal of that, and the reporting becomes really important. It shows response times to patient or resident calls for help, and it helps alleviates a lot of maybe miscommunication around care that's being provided.
Sure. And so, Vikas, you had mentioned at the beginning of this notion of moving patients through that process. And I think in some of the solutions that we've seen from Artisight and are directly involved in that, what's the benefit to the hospital of getting the patients through the process a little faster?
Yeah, so it's not necessarily just about speed, but really around the appropriate efficiency and ensuring that for patients, they almost have a digital hand holding them as they're walking through the process. So they have an understanding of what are the next steps in their clinic visit, for example, or where are they going after their operating room procedure. Utilizing this type of technology can really not only help them and calm some of their anxieties, but also provide their family members appropriate notifications of exactly what's going on. The personal tracking is a fantastic question, and I would just highlight that as a former executive in academic medicine, the best way around any implementation of technology is similar to what Susan and Stephanie highlighted, right? If you start taking pillars of lean methodology and actually having staff involved in the decision making and helping them determine and decide what the appropriate workflows are, the technology can help augment that. And so personal tracking can be tricky, but if you're able to show the value and show that it's actually removing items from the staff having to do, and that it will actually make their life easier and their work life better, there's real value from that standpoint. And they will trust the system once they start seeing things actually coming off their plate, as opposed to technology adding more work to their plate.
So how do you do that? I mean, Susan, whenever, it's not like you can get people to herd them into a classroom and deliver a training on that. How do you do that whenever, there's the never-ending process of a hospital? How do you impose change in a dynamic environment like that?
So, I've been doing this for 20 plus years, and being in their shoes, I guess it's a little easier to understand their pain points. I will say that listening is critical. I know it sounds basic, but you'd be surprised how many companies truly don't listen to the subject matter experts. So I think that is a very critical point. You need to really listen and try to understand what their pain points are, because if you don't, you're going to miss what they really need in order to achieve their outcomes. Creating cultural buy-in is critical. And the only way to do that is to obtain the actual subject matter expert input. You ask them, what's going to make your processes easier? What's going to make your life easier? Tell me about your shortcuts. What are your pain points? And then you connect them to the information and workflow that they need by automating it for them and showing them, proving it to them that it's much easier in their day-to-day, and they could spend more time with their patient, which is truly why people go into the healthcare industry, is really to focus on the patient. So once you obtain that information from the bedside staff, it's very simple to really implement, because then you create the buy-in and they do it for you.
Yeah, excellent. It just seems to me to be a daunting process because of the, like I said, the dynamic nature, and to spend the time with them at the consultative level, and then at the point of introduction, being able to help show them how the benefit of that occurs. It seems like it can be a difficult process, like herding cats.
If you're asking me that question again, I personally would say no. But I know that there's a lot of people that struggle. And again, I think the reason why NESA is unique is because they have clinicians on their team that have been there, done that, and they really get down and dirty with the subject matter experts and really try to drive what is needed from that level up. It is not a top-down company, nor do we believe that, necessarily the IT or C-suites, basically they drive the decisions, but the information and really what is needed has to come from the patients. It has to come from the nurses. It has to come from biomed. It has to come from the people that are doing the daily work. It is not a force-feeding process in healthcare. And that is what makes us successful, is because we engage them.
Excellent. Vika's touched on process automation, and Stephanie, I'd be interested in understanding what areas of process automation are you seeing done in conjunction with location in your vertical. Are there some, easy low-hanging fruits that you always go to solve, or problems to solve whenever you approach a healthcare environment, whether that's a clinic or a hospital?
I think, and we've touched on it a little bit, which is RTLS really is about automating so many things, from workflow of patients to sterilization of equipment. It could be everything of part level and understanding alerting to help notify biomed staff to either replenish or pick up dirty equipment. We've seen a lot of workflow automation around tags together. The whole contact tracing has really, I think, pushed forward a lot of that context. I mean, even around in a manufacturing facility or warehouse where two pieces of equipment are heading towards each other, that location data helps automate so many things. The only, we talk a lot about any concerns around RTLS implementations. The only one I think we continue to see is making sure customers fully utilize the infrastructure and the hardware that they've deployed, continue to build on that.
Well, that's sort of a part of the Quuppa mantra to do more with location. You guys, that used to be a tagline that we had years ago, but we're starting to find that that's a relevant message to many customers over and over, independent of whether it's healthcare or Industry 4.0 as an example of, you have this infrastructure up there. How many different problems can we solve? And we try to state ourselves as the gift that keeps giving in that regard. What do you see what are some of the risks that you've seen with the implementation of RTLS, whether it's ours or any other companies? Susan, I'll start with you on that.
I mean, when it comes to risks, really, I think the decision makers, when you actually choose an RTLS company, you need to really understand what it is that you want. And I think one of the risks is they don't know what they don't know, and they don't know what they want. Not until you're actually in there and you begin to speak with everyone and really understand what they need. Sometimes they spend a lot of unnecessary money trying to put in new, let's say, beacons or whatever technology it is, whether it's BLE, ultra wideband. And then what happens is they want workflows that you really didn't need that technology to create. So I think it's really critical to understand what it is you're trying to solve prior to really installing and being committed to one particular RTLS company, where we as NESA can ingest any RTLS information. So that's really what allows our system to be very flexible, providing reports and whatnot based on what it is that they want. But again, they need to know what they want, and sometimes, and most of the time, they never really do initially, which is why it's so critical to really have great relationships with your customer so that you can deliver ultimately what they need.
And Stephanie, I know your company deals with a lot of different RTLS, manufacturers out there. What do you see in terms of, what are the risks and the challenges that other healthcare providers have experienced in implementing this?
I would say some of the challenges that I've seen being in this space for so long is maybe depending on a hardware vendor to do things that they were not equipped to do. So a lot to Susan's point, there are so many new up and coming technologies that do certain things very, very well. And that's absolutely an advantage of our platforms, is the ability to take in data from any data source. And a customer can use multiple technologies. They all funnel to the same dashboards and reporting engine, and the customer knows no difference. So the technology becomes extremely important in that it can provide the goal of that use case.
So when we talk about the benefits, obviously everybody jumped on asset tracking to start. And I think we all kind of understand that the efficiency that's brought by knowing where things are, and again, that transcends any industry really. But what do you see in the healthcare space? What is the biggest benefit? Is it cost avoidance? Is it compliance? Is it patient satisfaction? Where do you see that it gets the most attention whenever you're looking to introduce your solutions? Susan, I'll start with you.
I really feel that it depends on the organization. Some organizations have no trouble with, let's say, productivity. Others don't really have much problems with tracking their assets. Although now with COVID, I would beg to differ. So I really feel it depends on the healthcare organization, but I can tell you most of the bang for the buck really, especially now, has been a lot with asset tracking, so that you don't lose or misplace your valuable assets. But not just that, there's staff that really spend a lot of unnecessary time trying to find critical assets, and so that time will be saved. And so, I feel there's a lot of value to those applications, but across the board as well, in streamlining their workflows. Even at a comprehensive cancer center, we created patient journey experience for them, and they were able to really cut down on the patient wait time, which evidence shows, it really brings much value as to the perception of the care that they're receiving. So in streamlining critical workflows, that assists as well, and so does the efficiency in turning over OR rooms for high revenue streams. So, really it applies to a multitude of use cases, and it really just depends on what the organization's needs are.
And Stephanie, whenever you approach a healthcare provider, or do you find that you're usually responding to compliance or cost avoidance or patient satisfaction requests, or are these usually, we've got a specific problem that we want to solve, and how do you find yourself, in terms of introducing the biggest benefit?
I feel like we've seen a really nice shift to now focusing on the patient experience, and patient satisfaction is driving a lot of decisions that are getting implemented. A close second to that is the data, and the data is what drives all of their operations. And RTLS data provides all of the information they never had before. It starts automating everything. We talked about the he said, she said type scenarios that it alleviates, but also understanding rental equipment that was in a procedure room and was used, so we actually know how much to pay for that. There's also all the historical reports. We start to be able to analyze value-added time to non-value-added time in clinical settings. we can start to understand care provided in senior care for reimbursement. So the list, I think, is really endless, but data is a huge driver of one of the biggest benefits.
So, Vikas, do you see healthcare providers that approach problems at these acute pain points in their operation, or do you find yourselves approaching management with a much more strategic view of all the different things that you endeavor to solve? How does Artisight approach that, and what's your experience?
Yeah, so I mean, I think healthcare executives have a very challenging job for specifically what you just highlighted, right? They are dealing with putting out fires every day, but also have to think about long-term strategic positioning and ensuring that they are moving and investing in ideas and innovation that's going to set them apart from their competitors. I think healthcare leaders actively work on setting a long-term vision to address the problems, but also work with their operational frontline leaders to really solve those problems in real time. What we've started to notice is that there's been a big investment by these organizations to start developing innovation departments that are specifically focused on the long-term solutions. And I think this is where Artisight really has seen success, is being able to partner not only with your frontline leaders, but also with your C-suite folks, where our products provide value day one, but continue to grow with the organization and continue to help solve future problems for that organizations based on the different sensors that are deployed kind of within the environment.
I guess, Stephanie, share us a little bit about Zillifly's go-to-market strategy, and try to give us an example of how you find yourselves introducing your solution.
Yeah, so we had been in the RTLS space prior to starting Zillifly, and so there's some things that we wanted to do differently. And that starts out with our approach on how we sell. And we sell the model of our customers can do straight up locating of people and things, and then they can come back and buy applications as they want to, or if they even need them. That really alleviates that feeling of them being nickel and dimed or having to pay for a lot of software that they're never going to use or don't want to use. So they can buy the applications, asset management, staff, workflow, as those come up during a phased deployment approach. The other piece too that we provide are two different ways for them to purchase. The perpetual is the most traditional capital asset purchase model, is where we had seen a lot of the RTLS industry focus for so long. But the last couple of years, we've seen a really nice shift to a true subscription or SaaS model, which is really nice for us since we offer both an on-site deployment and a cloud-hosted deployment.
It's interesting. I know this wasn't on our list, but I'll throw it out there in terms of this notion of cloud. And there's a lot of industries that have always looked to depreciate software, so, as a CapEx, or all solutions as a CapEx type of model, because it gets used over time based on its actual shelf life is longer than the usual depreciation cycles. How do each one of you find, Stephanie, I thank you for launching this, but how do each one of you find your ability to market a cloud or a recurring revenue type of model into your in your business approach with your clients? Because I'll start with you.
Yeah, I mean, I think we find ourselves to be fairly flexible in what matches with the client's needs, right? So if a client is more comfortable with on-prem solutions, and again, as our platform has much more than just RTLS, we leverage a variety of different type of sensors in the clinical space. It really depends on what that client is comfortable with. And regardless of it being on-prem or cloud, having that SaaS type of model is what we have found to be key. It continues to not only hold us accountable to making sure that we continue to meet the client's needs, but allows us to continue to grow with them as well. And so as they have new problems that come up or problems that they're actively trying to solve, we're able to quickly adapt and move forward with that new solution for them as well.
And Susan, I think Nesta has a similar balance as well, and I think you've seen examples of that in both buckets, if you will.
Yes, absolutely. We have a very flexible structure, and we are cloud-based. But again, we can also put it on-prem, as Vika shared as well. So it all really depends on what the customer is in need for.
And I guess, Susan, in working in the U.S. versus internationally, when our healthcare system is very different than any other place in the world, being a for-profit entity, through almost at every angle. How do you find innovation and the pursuit of solutions differing from the U.S. versus internationally?
Well, I think it definitely is quite different. And I think we learn a lot from each other, both from the US and then internationally. It's interesting. I did obtain an ISO certification for international standards. And so as one of the lead auditors, it has now allowed me to take on this additional perspective, specifically when it comes to healthcare. The US has a lot of similarities with other customers that we have internationally, but then there's a lot of differences, even as basic as to the role of the nurse. So role to a nurse in the US take on a different meaning when it comes to a European nurse. So they do different functionalities. So you really have to understand it. So I think understanding the standards internationally as well as in the US. And again, it goes back to understanding what the customer really needs, because it is and it does differ from what is needed in the US. So basic hand hygiene, it can seem basic, but just where, for example, one of our European customers has their hand sanitizing machines, is on the foot of the bed, which is completely different from where, exactly, which is completely different from where the US keeps them. So you have to really understand the detail and understand the workflow, and then you can make them successful. So this has, again, a lot to do with talking to the bedside nurses and the subject matter experts, and then anything's possible, whether it's within the US or internationally.
Fascinating. By the foot of the bed. I never who'd have thought it. I guess there's a reason, there's a logic there somewhere, but I won't ask where that is. But so since we touched on the fact that the U.S. has a for-profit healthcare system in general that brings the issue of ROI for any operator and the return on investment, and when you start talking about ROIs in IoT, that can, sometimes IoT projects are a wait and see. We don't know. Let's study the data and then we'll figure out what to do next, which requires perhaps deeper pockets. And a lot of places are looking for a solution to come in and a panacea solution that comes in and solves everyone's problems. How do we solve the siloing challenge that we tend to find where one solution gets applied to one problem and then we silo technologies accordingly? Because I'll start with you on that. What are your thoughts on how do we improve this silo challenge?
Yeah, I mean, I think that's tough, right? I think the ROI aspect of it falls to each unique client. And so from an academic medical center standpoint, I can tell you that how people maintain budgets is critical, and the return on investment to utilize capital dollars or operational funds, you have to be able to justify why you're spending that money, and it impacts you on what you're able to do the following year. And so as administrators, I think they're really looking for projects or technology, whether it's IoT or not, that provides value day one. I think our focus and what I highlighted earlier was our goal with any of our solutions we put out there is to be able to provide value on day one, so that there is a return on investment that you are able to utilize, where you're able to take those savings and move forward with additional solutions on a platform like ours, where you can then solve additional problems that you may not have initially focused on because the ROI didn't make sense. But you focus on one large problem, utilize sensors, whether it's RTLS or not, to solve that basic problem and show a minimum of a 4x type of return on investment, you really can start to tackle smaller problems that just continue to erode at the bottom line for your institution.
And Stephanie, you were describing your go-to-market strategy earlier. I mean, how does that apply? I guess by being able to take those modules and apply them to certain subsets allows you to sort of land and expand. I guess is that sort of that's perhaps a crude way of saying it, but is that the strategy here?
Absolutely. And I know I mentioned this, but I absolutely believe in a phased approach, and very close communication with you and the customer as to the goal of that phase and what needs to be accomplished to continue moving to phase 2 and 3. And ROI is, sometimes part of that, but there's a lot of information that you need from the customer as well to be able to check those boxes. And Vicus, I totally agree with the comments around utilizing the existing infrastructure and understanding what's in place to accomplish some of those small check boxes that you might be able to tick off. The other piece around that that we have found to be really helpful is connecting our existing customer base. So the more information that our existing customers share amongst themselves or user groups really allows them and us to leverage all of that knowledge, making the implementations much more successful for everybody.
Huh, fascinating. So we're all stronger together, I suppose. That's
Yes.
the message here. And Susan, in Nessa's approach to the ROI, do you go after these acute challenges, or try to get an early win and then try to tackle the subsequent ones, or is this approach at a much more strategic, overarching level? How does that work?
Well, we have a very flexible platform, but I think that everyone here agrees that the best approach is to really try to deliver what the customer needs. And if it's just one particular aspect of it, such as asset management, then it's definitely delivering what they need at first and then expanding. So I think once they, get to know what the platform offers, and being a horizontal platform, they will immediately be able to provide additional patient safety and rounding and surveying and everything else related to the platform. So, I think that's really the best way to do it. And regarding silos, I do want to mention, I think it's very critical, not just in offering the platform as you say, in a siloed approach. I think it's when you implement and when you deploy something, it is critical that it is not done in a silo approach. You have to be very collaborative with all the different departments in order for it to really be successful. And they're the ones that will be your internal cheerleaders, and that's really how your platform expands, as you said, Tom. So that is the success of really deploying.
Yeah, so that's it's interesting to see how we there's so many things to solve, and I think this just goes to show that it's still very early days in this industry, even though RTLS has been around for a while. And it's just interesting to see how there's just so much more that can be done in this particular industry as well as in many of them. I'll close with this question, and it's just sort of an open-ended one. It's been an honor and a privilege having each one of you here, and I guess whenever I callously say sometimes that Quuppa puts the dot on the map, but so what? I think our audience has just heard the so what part, of how it becomes relevant in the hands of people who really know what they're doing in their specific industry. So I'm again honored and privileged to have each one of you spend some time with us here today. I'll close with this question and just asking you, what technologies are you excited about? And it doesn't necessarily have to be healthcare related. Could be, the fact that Jeff Bezos is going to to Mars or something. Whatever is top of mind. Vikas, I'll start with you.
Yeah, I think the exciting stuff about technology is really the technology that's starting to work passively and kind of behind the scenes. And so whether it's healthcare or not, but obviously our focus is on healthcare here, but I would say the passive type of technology that really allows providers, whether that's your physicians or your nurses, to really focus on patient care and not necessarily have to be chained to a computer to document items, but really being able to allow them to be with the patient, which is what they want, right? So I think the technology that really is going to work on the back end that doesn't require them to do anything is really what's exciting and the way of the future here.
Yeah, provocative answer, considering that we're talking about technology, which lends we all think about cyborgs and whatnot and strange things, but at the end of the day, it really comes down to human contact. So Yeah, great answer. Susan?
I'm really excited about computer vision because, yes, I agree with Vikas for sure. I think, if technology could do the work for you and you could spend more time with the patient, everyone's for it. And I think computer vision really will bring an additional layer of enhancement and safety and satisfaction to many people that really will increase productivity. So that's one thing I'm really excited about.
Awesome. And Stephanie?
My opinion would be artificial intelligence. I've talked a lot about the power of the data, and I absolutely believe in that, and we all do. We all have platforms and reporting tools that provide that data back, which is what we should do. It's extremely important. It's what helps all of our businesses make business decisions, and we provide that data back to them readily, whether it be within each of our tools, through an API, integrations, with AI tools. But that collection of data and being able to get it back in the customer's hands in a meaningful way so that they can make good decisions is really our goal.
Spoken like a true software person. Well, again, thank you so much, everyone. It's been a pleasure and, again, an honor to have you here. We look forward to working with everybody, and best of luck through the rest of the year.
Thank
you.
Thank you.
Thank you, Tom, and all the panelists. Now that the healthcare sector is really starting to recover finally from the pandemic, I'm sure that there will be a lot of focus on ensuring both staff and patient safety for the future.